Welcome to Capital Health Plan. This webinar will assist you in learning the State of Florida Capital Health Plan benefits. Capital Health Plan's mission is to provide high-quality, affordable health care that focuses on delivery of evidence-based medical care in an effective, timely, and cost-effective manner, emphasizes low administrative cost and ethical business practices, is proactive and innovative in its quest to continually improve the health of the community. Capital Health Plan was established in 1982 by a group of Tallahassee civic leaders that came together to create a quality, affordable health care system to meet the health needs of the community. Over 38 years later, Capital Health Plan has become a national health care leader. CHP started with 5,000 members and a network of 75 doctors. Capital Health Plan has grown to more than 130,000 members with a broad network of more than 400 doctors, hospitals, and other health care providers throughout our service area. CHP has proudly served the state of Florida employees and their dependents for over 37 years. Capital Health Plan has consistently been recognized as the top plan in Florida and among the highest rated plans in the nation. According to NCQA's private health insurance plan ratings, CHP's private commercial plan is rated 4.5 out of 5. According to its Medicare health insurance plan ratings, CHP's Medicare plan is rated 4.5 out of 5. No other health plan in Florida achieved ratings that high for either their commercial or Medicare plans. Where is Capital Health Plan located? Capital Health Plan's new Metropolitan Health Center, located at 1264 Metropolitan Boulevard in Tallahassee, includes physicians' offices, lab services, imaging, Nancy Van Vessem, MD Center for Healthy Aging, urgent care, wound care, and Center for Complex Care. Urgent care requires that members call ahead for a same-day appointment. Urgent care is open 11 a.m. to 10 p.m. Monday through Friday and 9 a.m. to 8 p.m. Saturday and Sunday. Call 850-383-3382 for an appointment. This building is just off of I-10, the Thomasville Road exit, and provides easy access for our members. The Centerville Place Health Center, located at 2140 Centerville Place in Tallahassee, includes physicians' offices, lab services, imaging, colon screening program, pediatrics, and eye care. Governors Square Health Center, located at 1491 Governors Square Boulevard in Tallahassee, includes physicians' offices, lab services, imaging, the infusion center, and eye care. Eligibility requirements. You must be eligible for the state of Florida state group insurance to obtain this coverage. You must also live or work within CHP service area, which is Calhoun County, Franklin County, Gadsden County, Jefferson County, Leon County, Liberty County, and Wakulla County. If you live outside of one of these counties but work in one of the counties listed, you are eligible for coverage with Capital Health Plan. Benefit plan choice is yours. The state of Florida employee has a choice between two benefit plans. The standard plan has no deductible. Coverage begins on the first day with low co-payments and lower maximum out-of-pocket cost. See the State of Florida Benefit Guide for Flexible Spending Account FSA information. The high deductible plan has a deductible. Co-payments are 20% of the contracted rate after the deductible is met, and maximum out-of-pocket includes the deductible. See the State of Florida Benefit Guide for Health Savings Account, or HSA, information. Deductibles and out-of-pocket maximums. There is no deductible for the standard plan. The deductible for the high deductible plan is $1,400 for single coverage and $2,800 for family coverage. The deductible does not apply when you receive preventive care services. Medical out-of-pocket maximum per calendar year, also called MOOP. This is the most amount that you would pay for medical services for any calendar year. The standard plan has $1,500 for single coverage and $3,000 for family coverage, not to exceed $1,500 per health plan member. Once you reach this out-of-pocket maximum for coverage, you have no more copays for medical services for the remainder of the year. The global out-of-pocket maximum, including prescription drugs per calendar year. These are co-payments, co-insurance, and deductibles that have been paid for both medical and prescription drug benefits. The standard plan option is $8,550 for single coverage and $17,100 for family coverage, not to exceed $8,550 per health plan member. The high deductible plan option is $3,000 for single coverage and $6,000 for family coverage. Copay versus co-insurance. Under the standard plan, your primary care physician visits are only $20 and all specialist visits are $40. If you have an annual preventive service examination, there is no copayment. Under the high deductible plan, once you have met your deductible, you will pay 20% of the contracted rate for primary care physician and specialist visits. If you have an annual preventive service examination, there is no copayment. Remember, if you mention that sore throat while receiving your annual preventive service examination, you may be subject to a copayment, deductible, or coinsurance for that visit. Hospital services. With the standard plan, hospital admissions are $250 per admission. And if you have surgery in an ambulatory surgical center or hospital, but you are not admitted to the hospital, then there is no copayment. With the high deductible plan, hospital admissions and surgeries performed in an ambulatory surgical center or hospital do have a 20% coinsurance once you have met the deductible. Emergency services. If you are on the standard plan and you have to go to the emergency room, you pay $100 copay per visit. Urgent care visits at CHP Urgent Care Center or at TMH Urgent Care are only a $25 copay per visit. If you are taken to the emergency room via an ambulance, there is no charge. If you are on the high deductible plan and you have to go to the emergency room, you pay 20% of the cost once you have met your deductible for emergency room visits, urgent care visits, CHP Urgent Care Center, or TMH Urgent Care, or ambulance services. If you go to the emergency room on the second day of your coverage and you are on the high deductible plan, you will meet your deductible before the 20% coinsurance becomes effective, and there may not be sufficient funds in your HSA account to pay that deductible. You cannot change to the standard plan until open enrollment. Amwell, a telehealth service, is a $0 copay per telehealth call. Prescription drug coverage, CVS. Your prescription drugs are covered through CVS, and you will have a separate ID card to present to the pharmacy. Your copays under the standard plan are $7 for generic or Tier 1 drugs, $30 for preferred brand name drugs or Tier 2 drugs, and $50 for non-preferred brand name drugs or Tier 3 drugs. Your copays under the high deductible plan after you meet your deductible is 30% of the cost for generic or Tier 1 drugs, 30% for preferred brand name drugs or Tier 2 drugs, and 50% for non-preferred brand name drugs or Tier 3 drugs. If you have a prescription that is in the third tier, check with your physician to see if there is another drug that is in a lower drug tier. Examples of how the plans work. Still confused as to which plan is best for you and your family? Perhaps the following examples will assist you in making your decision. If you go to the primary care physician for an office visit and the actual cost of that office visit is $175, then you will pay $20 under the standard plan option, $175 under the high deductible plan because you have to pay your deductible first before the coinsurance begins. Emergency room visits can easily cost $2,500, but on the standard plan option you only pay $100, and the high deductible plan members will pay the rest of the deductible of $1,225 plus 20% of $1,275, which makes it a total of $1,480 out of pocket. If you have family coverage on the high deductible plan, you will pay the full $2,500 out of pocket because you have to meet the deductible first. You go to your primary care physician's office and standard plan members continue to pay their $20 while high deductible plan members with single coverage will pay 20% of the $175 or $35, while high deductible plan members with family coverage will pay the rest of their deductible plus 20% of $50, which is $10 for a total of $135 out of pocket expenses. Then you have another emergency room visit, and standard plan members continue to pay $100, while high deductible plan members with single coverage will pay 20% of the $2,500 or $500, and high deductible plan members with family coverage will pay 20% of $2,500, which is $500. As you can see, this can really add up for the members on the high deductible plan. So how does the maximum out of pocket work? For members who choose the standard plan, they have paid out $240, which applies to the $1,500 maximum out of pocket. Once the member reaches the maximum out of pocket cost for medical services, there are no more copays for that calendar year for medical services. Global maximum out of pocket medical and pharmacy, both copays are applicable to the GUPM. Standard plan members have paid $240 out of $8,550, so their remaining GUPM amount is $8,310. The high deductible members with single coverage have paid out $2,190 out of $3,000. So they now have $810 to pay before they reach the GUPM limits to have no more copayments. The high deductible plan members with family coverage have paid out $3,310 out of $6,000, so they now have $2,690 remaining GUPM before they will reach the limits to have no more copayments. How to access services. You would, first of all, Capital Health Plan members should choose a primary care physician. You can go to Capital Health Plan's website at capitalhealth.com and go to the providers to find a provider that is within our network. You want to go to a contracted provider. When you utilize a contracted provider, you pay the applicable copayment or coinsurance at the time of service. Primary care physicians. You have the choice of primary care physicians within CHP's network. There are CHP-only physicians under the physician group of Capital Health Plan. There are approximately 20 full-time staff in the physician group of Capital Health Plan. These physicians accept CHP members only. You can also choose affiliated primary care physicians located within CHP service area, and there are over 120 contracted primary care physicians affiliated with CHP. Perhaps your doctor is already part of Capital Health Plan's network. Your primary care physician can be an internal medicine doctor or a family practice physician. The PCP for each family member can be a different, or your children's PCP can be a pediatrician. You can find who the Capital Health Plan network providers are by going to capitalhealth.com, click on Provider. Once on the provider site, click on Provider Tools, and once you are on the Provider Tools site, click on Provider Directory. From this point, you can see a list of physicians that are in CHP's provider network. If you know the primary care physician that you would like to choose as your physician, contact CHP Member Services at 850-383-3311 and let them know the name of that provider. Still not sure who to choose? Call CHP's Member Services and they will assist you in choosing your primary care physician. Your primary care physician will assist you with authorizations for lab, x-rays, specialty care, and hospitalizations. Your PCP emphasizes preventive services through office visits, physicals, immunizations, and diagnostic testing. There are over 300 specialists in Capital Health Plan's network. There is no referral necessary for most specialist office visits or consultation. Pre-authorization is required for certain procedures and some diagnostics. Your specialist will work with your primary care physician and/or CHP if an authorization is necessary. Participating hospitals. Hospitals in Capital Health Plan's network include Tallahassee Memorial Hospital, Capital Regional Medical Center, Select Specialty Hospital, Calhoun Liberty Hospital, George E. Weems Memorial Hospital, and UF Health Shands Hospital. Note that authorizations are required for inpatient admissions and other centers of excellence. Away from home care is available for dependents and you if you are going to be temporarily outside of the CHP service area for 90 consecutive days or more. There is no additional premium for this service. Away from home care membership is great for your college students going out of town for college or providing health insurance for dependent children who are living outside of the service area with their parent. Membership is provided as a guest membership with a participating HMO Blue in the area where the member is staying. The co-pays under Away from Home Care depend on the co-pays established by the HMO where the dependent is a guest, also called the host HMO. You must apply by calling 383-3311 to verify if Away from Home Care is available in that state and that county, and requesting information with an application be sent to you once you have been established as a CHP members. Emergency care or urgent care. Emergencies and urgently needed care are covered anywhere in the world. You are not required to use Capital Health Plan providers or call first, but you should notify your PCP or CHP as soon as possible after your visit. Enjoy worry-free travel. Emergency room or ER should be used to treat emergency medical conditions. Urgent care should be used for an illness, injury, or condition serious enough to seek care right away, but not so severe as to require ER care. Connect to Care, what to know before you go. Amwell is a telehealth service. Call if you have allergies, coughing, cold, flu or fever, earaches, minor infections including UTIs or respiratory symptoms. Calling Amwell provides access to services remotely. You don't have to leave your house, or you can be in another state. There's a quick response time, and it is available 24 hours a day, 7 days a week. CHP Urgent Care. Call 383-3382 first as they set up same-day appointments. Going to urgent care provides lower co-pays, there is a shorter wait time, and the urgent care hours are extended. Emergency room. Go to the emergency room for major trauma, strokes, chest pains, severe abdominal pain, numbness in limbs, or severe shortness of breath. Your copayment is higher. You may have a long wait time, but they are 24 hours a day and 7 days a week. Amwell is a telehealth service. This is a new benefit for the state of Florida members. It is a faster, easier way to see a doctor with mobile or web access 24 hours a day, 7 days a week, 365 days a year. Download the app now. Search the App Store or Google Play for Amwell. Step 1. Enroll to create your account. Step 2. Enter the service key CHP. Step 3. Select the doctor you'd like to see. Please note that the service key CHP is very important when setting up your account. There is a $0 copay for the Amwell telehealth service visits. Urgent care, when your primary care physician is not available and you need immediate help, but not the emergency room. Capital Health Plan Urgent Care at 1264 Metropolitan Boulevard in Tallahassee, Florida, is open from 11 a.m. to 10 p.m. Monday through Friday and 9 a.m. to 8 p.m. Saturday and Sunday. Call 850-383-3382 for a same-day appointment. TMH Urgent Care is located at 141 Medical Drive, Tallahassee, Florida, 32308. Call 850-431-7801. They are open from 9 a.m. to 9 p.m. TMH Physicians Partners, located at 178 LaSalle FL Drive in Quincy, Florida, 32351, is open from 9 a.m. to 8 p.m. Monday through Thursday and 9 a.m. to 5 p.m. Friday and Saturday. CHP Connect. CHP Connect is a secure online electronic personal health record available at capitalhealth.com. CHP Connect is a personal history of doctor's visits, diagnosis, medications, test results, health care library, and explanation of benefits, or EOBs. Claims. Have you received a bill from a provider? You should not receive a bill from your provider. Co-payments, co-insurance, and/or deductible are due at the time of your visit. Your claims can be reviewed on CHP Connect. Call Member Services at 383-3311 regarding any concerns or issues. Did you receive a bill from services that were not provided? Please contact Member Services. Appeals process. Members should attempt informal resolution of any dissatisfaction by calling Capital Health Plan Member Services at 850-383-3311. If Capital Health Plan is unable to resolve the matter on an informal basis, the member may submit a formal request for review in writing. Capital Health Plan Member Services contact information. Capital Health Plan Member Services Department representatives are available to take your calls at 850-383-3311. The local address is 1264 Metropolitan Boulevard, Tallahassee, Florida. The lobby hours are from 8 a.m. to 5 p.m. Monday through Friday. The mailing address is Capital Health Plan, P.O. Box 15349, Tallahassee, Florida 32317-5349. A secure fax number is 850-383-3413, and Capital Health Plan's website is capitalhealth.com. Why choose Capital Health Plan? There is exclusive access to the physician group of Capital Health Plan, exclusive access to 3 Capital Health Plan health centers offering primary care, urgent care, lab, diagnostic testing, x-ray, eye care, and more. Fitness reimbursement up to $150 per household each year. Why choose Capital Health Plan? Low co-payments, low out-of-pocket maximums each year, local and trusted health plan, local member services, nationally recognized and highly rated health plan, large network of providers, referrals to Shands in Gainesville and other centers of excellence. Reasons to choose Capital Health Plan: worry-free travel, emergency and urgently needed care coverage anywhere in the world, national LabCorp coverage, dialysis coverage, national recognition for billing purposes through Blue Card. Questions. Capital Health Plan. Do you have any questions for Capital Health Plan? Thank you for viewing this webinar. We hope that you will consider Capital Health Plan for your health care option. For additional questions, please contact Capital Health Plan Member Services at 850-383-3311. Thank you and have a great day.